Hello, Bell's Palsy here. Today, just a reminder. I get this question a lot, and I totally understand when things are healing very slowly with Bell's Palsy or Ramsay Hunt or any kind of facial paralysis. At the end of the day, it's a very slow healing thing because it's a nerve injury. Nerves are the slowest healing tissue in our body, and people are always asking me, it's like, what else can I do? What kind of treatment? Should I do acupuncture? Should I go to a chiropractor? Should I take vitamin B12? And really, truly, there's really, again, I think I've said that before, but I think there's really nothing that you can do to speed up that nerve healing. You just have to be patient. You just have to let it happen. What I would do is try to disconnect sometimes from your condition and just kind of my best advice would be keep living your life. That is the best thing. If you are at home and desperate and very in kind of a negative environment, it's also not good for the healing process. It doesn't help. So that said, people are asking me, what about chiropractic treatments? And there's nothing that a chiropractor is going to do, or there's nothing that someone can do to you to make that nerve heal faster. That's just not a thing. It's time is of the essence. Time is the only thing that will allow your nerve to heal. Of course, sometimes that nerve healing doesn't happen as you expected. That is when you end up with synkinesis. And there's also nothing that you could have done to prevent synkinesis. Synkinesis happens because of the way your nerve heals back, and that has directly to do with the level of injury that nerve suffered. And again, there's nothing you could have prevented, nothing you can do afterwards, nothing you can change. It is what it is. Thankfully, most people with Bell's palsy, about 2/3 will recover without those complications. 1/3 though will not be as lucky, and of course the degree of synkinesis can vary significantly. Some people have barely any kind of synkinesis. Some others have completely disfiguring synkinesis, and that's when, and hopefully even as the symptoms are appearing, this is when you need some help in targeting the right stretches to keep your face looser in order to prevent that synkinesis from being even more harsh on your face. And then if the stretches and then the neuromuscular retraining, which is retraining movement patterns in a non-synkinetic range. If that's not enough, then Botox is also very helpful in combination with facial rehab. And if that's not helpful enough, and if there's just severe synkinesis that cannot be treated just conservatively, then there's more aggressive surgical procedures, but truly the synkinesis is not completely 100% curable. I think people need to know that. I don't think they hear it often enough. And again, many people end up still with synkinesis, but being able to control that to 90 to 95%, and they can live a normal life. It does take some work sometimes in regards to continuing with key stretches, as well as some recurrent Botox injection. And again, there's so many different scenarios, so many different layers. Depends on the patient, depends on your tolerance to it, how much it affects your life, all of that. There's 1,000 scenarios possible. So again, I kind of went on a very big tangent there, but there is really, at the end of the day, there is nothing you can do to really speed up that nerve. Your nerve is going to take the time it takes to heal or not to heal fully, but you can't really do anything. And I think people needs to know that. And I think the more information there is out there in regards to all of this, I think the better it is, so people don't have false expectations and are well aware of all their options. So have a great day. I hope to see you later. And probably in September, I am going to go on vacation. I'm recording several posts today, so I will post until then, until I come back. So take care. Have a good day.